Well, dear listeners, welcome to this series of talks and discussions on learning to live with COVID-19. Well, this is an effort of the Evergreen GMC 82. We are the batch of 1982 MBBS from Gauhati Medical College. We are all aware, sorry, we are all aware that what started as an outbreak of an unusual flu in China in December 2019, actually in Wuhan, China, and it started spreading so rapidly to involve the whole globe, and it became a pandemic. It has left a trail of death and devastation. Interestingly, India, with a huge population of around 130 crores plus, so far we have been doing quite well. If you compare our situation with Europe, which is a population of around 70 crores, or USA, which is a population of about 35 crores. So, but we need to keep our cool. We have to understand our role, and we have to act sincerely in order to maintain this advantage that we have. And so, in order to discuss about, because COVID is here to stay, that we all of us know. So, in order to discuss about these things, we are doing a series of webinars, and in this first panel discussion that we have an eminent panel of my batchmates. I have Dr. Sanjeev Chakravarty. He's a pediatrician. I have got Dr. Madhumita Priyadarshini Das. She's a professor in Medical College Gauhati, as well as she's a consultant at the Apollo Hospital, Gauhati. Dr. Monalisa Goswami Sarma is a neurologist at Nemcare Hospital. And Dr. Mandira Sharma is Chief ENT at ESIC Hospital, Gauhati. And with these words, I welcome you all to this discussion. And to start, start the proceedings, I would like to request Dr. Madhumita to tell us briefly about what is this virus all about. I mean, we have been learning new things about the virus all the while. So please tell us more about it.
So the subject, as Gautam has already introduced, is learning to live with COVID-19. I don't want to go into too much of the depth of scientific nitty-gritties about the virus. We know it's an RNA virus, and it actually presents like a common cold. It's very much like a normal common flu, which occurs every year. But what is the huge hue and cry about this? It's because it's a highly contagious disease, spreads by droplet infection through the respiratory tract by coughing and sneezing, and it can survive on fomites, that means where the secretions have got contaminated onto, and it can remain airborne for quite some time. Hence, my friends, in the course of this discussion, will tell you about the importance of hand hygiene, the importance of mask, and the importance of social distancing in the prevention of the disease, because we do not have a treatment or a vaccine. Hence, prevention is the mainstay of COVID-19. And the commonest presentation is, it presents like a common cold with fever, upper respiratory symptoms. Unusual presentations could be with diarrheal symptoms, skin rash, red eye, bleeding from different parts of the body. Loss of smell is supposed to be one of the very early symptoms of COVID infection in many patients. But what are the danger signals? Just remember this. If a patient who's running a fever and cold suddenly has respiratory distress or various forms of altered consciousness from drowsiness to unconsciousness, please rush to the hospital for advice. That's my introduction about COVID-19.
Thank you, Madhumita, for your brief but very informative take on the virus. And we'd like now to talk about the safety measures that we all need to take. And I think to start it, I'd like to request Dr. Mandira to kindly take over. I'm sharing a screen for her.
Yes, thank you, Gautam.
Yes.
Thank you, Gautam. Yeah. So I would like to quote Mahatma Gandhi before starting that self-restraint is the key to health, good health. So before we have plenty of measures, actually guidelines to be followed that has been laid by the Government of India, Ministry of Health and Family Welfare, and they have laid stress on the best way to wash our hands. As you can see from the photographs, there are plenty of ways where we have been washing hands for quite some time, and we wash hands daily, but I think we have not done it religiously. So now is the time that we need to focus our interest on good and a healthy habit of washing hands. So most of the times we know that it is our hands that carry that act as carrier of the germs. So a good hand washing habit cannot be overemphasized at this during this COVID situation now. So these are some of the ways that is shown how we can wash our hands, and I think our viewers have already noted down this. So we need to wash our hands with soap and water and make up a good ladder actually. It's not that we simply wash and that's done. It is not like that, but we need to grab the soap to cover all the surfaces of our hands and rub it on our palms as well as the dorsum of the hand in between the fingers, and for at least for a period of 20 seconds. So the WHO has already mentioned that we need to, if we, in our minds, we can sing the song of Happy Birthday. We sing many a times this song. Right. So if we repeat those two lines for 20 seconds, I think that is done for a 20 seconds hand wash. So, and hand should be washed before touching any of our facial areas, our nose, eyes, mouth, and also before entering the room. After entering the room, when we touch the doorknobs, we need to wash our hands. And where I would also like to mention that where soap and water is not readily available, we can use hand sanitizers, which contains at least 60% of alcohol. But we have to keep in mind that after using hand sanitizers, we should not put take our hands towards our facial areas. I think that is important.
Thank you, Mandira. It's now I'd like to ask Sanjeev about Dr. Sanjeev about the social distancing and the things that Dr. Madhumita had mentioned about. How much?
Well, the term social distancing as of now has come to some amount of repute and disrepute both together. Repute in the sense we find that this is the only way and means by which we can save each other. Now, if you say I social distance myself from Evergreen group, I become alone. So I cannot socially distance myself. We need to keep in touch with webinars, WhatsApp messages, phone calls, etc. So let us put it as physical distancing. Now, instead of social distancing as of now, what we advocate is everywhere, all over the world is physical distancing. Now, the space between, or the space that we need to leave between two persons is 6 feet. Our Prime Minister Honorable Narendra Modi ji has already said that do gaz duri hamesha rakho, and that is the most important thing. So do gaz duri, hand washing and face mask, this together probably will help us. Now, if you take the example of Japan, they had the infection a long time ago, but if you go by the statistics, the amount of people that have been infected is quite low. Now, why? They do not shake hands. They bow when they greet people. Secondly, they wash their hands and they have been using the mask religiously with adequate physical distancing. Now, I myself, I'm a standalone pediatrician. I have my chamber practice. Now, how do I maintain social distancing? See, in my practice, I deal with neonates and older children. Now, when a child in a family is ill, it's a big issue. Everyone gets equally tense, and all parents tend to, parents, grandparents, everyone, they want to become a part of the treatment process, and they have to come to the chamber. So in the pre-corona era, this term was coined by one of our batchmates, Anita Borwa. She's a dermatologist. She posted a few photographs and said, when we had a get-together, we were all hugging each other. That was the pre-corona era. Now in the pre-corona era, what had happened, we had a good aggregation. Our working place was full of people, but we had to tackle just one patient. Now in the corona era, what we have done, our appointments have become stricter. We see limited amount of patients, and what we do is with one baby or with one child, just one parent is allowed to come. In an hour, we see 4 patients. We have divided our slots between illnesses and vaccines, and this way we are managing about 15 to 25 children in a day, not beyond that. So physical distancing, hand wash, and mask. These are the cornerstones of treatment. And please be careful when you go out for your morning walks in the morning after 6 o'clock, of course, not before that. See that small children less than 12 years of age, they are seen loitering with the parents. You should make it a point to tell them, do not come out. And elders above 65, give them a warm namaskar. How could I help you? Please stay indoors.
Right. Thank you, Sanjeev. I'd like to ask Monalisa to tell us more about how to wear the mask properly. Monalisa, you are silent. Just a minute. Please unmute.
Yeah. Can you hear me now?
Yes.
I'm sorry about that. Yeah, thank you very much, Gautam. We must all remember that this whole situation of COVID-19 is extremely new for the whole world. We had no experience of what was coming and how we are going to deal with it. So our knowledge of this is just emerging. Every day we are getting new insights into it. And it's still now our knowledge is at a very nascent state. So we are trying to do whatever is best for us, and in that we need to follow certain guidelines, especially in hand washing, which already Dr. Mandira has said, and about social distancing, and now it's mask wearing. So I would like to tell what the WHO has recommended for mask wearing. So it says that before putting on a mask, we must wash our hands prior to that. Then the mask should cover the nose, mouth as well, and it should be quite tight, most often when we go out, we find that either the nose is exposed or people have pulled down their masks to their chins, and it's sort of a very casual approach to wearing a mask. So mask should cover the full nose and mouth area, and it should be tight. It should not be loose. And once we wear it, we should avoid touching the outer part of it. And in case we touch, we must immediately remember to wash hands again. And while removing the mask, we have to remove it from behind. We should not forget to not touch the front, and then it has to be disposed of in a very appropriate manner, because disposal of masks very casually can also lead to COVID spreading. Then we must remember that masks are effective only when it is used in association with hand washing. And we must also remember that there should be no sharing of masks. Very often people are so casual that it's just, they're doing it just because they're being instructed to do it. So for each family member, they should ideally have 2 sets of masks. If it's a homemade mask, then they should have 2 sets of masks, and one they would wear this today, then wash it, wear the other one in the meantime. And like I said before, proper disposal of mask is very important. So with all these things, hand hygiene, then social distancing and staying at home as far as possible, and the use of masks, and also sanitizing the surfaces at home, the surfaces which we frequently touch, like door handles, door knobs, tables, then our PCs, our mobiles. Once we sanitize all these 4 things are going to take us a long way in preventing rapid spread of this illness.
I think you have put it very nicely. This is something very important because once we go out, even if you're not going to a hospital, every time one comes back, one has to be very careful about what he is or she is carrying inside. And hand hygiene, wearing masks properly, and sanitization of the surfaces is very important. We have seen in the media, in the newspapers, there have been people who have been afflicted with this particular problem. And whenever a person has COVID, it's the neighbors, it's the people around that person. There's a lot of stigma involved. There's a lot of concern. People get worried unnecessarily. And whether, how can we remove this stigma? I mean, one of you, maybe Madhumita, can you take over? Can you say a few words on how to remove this?
That's
1 minute. Just before going to the stigma, let us finish one more part of the mask.
Yes.
Monalisa, please enlighten us. We basically have 2 or 3 different types of masks.
Right.
One which the doctors or the forefront workers wear it inside the ICU or the ward.
Right.
The second which we general public wear outside. Now the mask which you make at home, they basically are of 2 layers or 3 layers of my inquiry from you is, what should be the number of layers of cloth that we do put in the mask when we make it at home? And secondly, what is the time when we remove the mask? Once it gets soiled or after a certain period of time in terms of hours?
I wouldn't know too much about the hours, Sanjeev. I'm tackling your second thing first, because if it's a homemade mask, I mean, they use it and wash it as frequently as possible. I have no idea about the hours. What would you say? Would it be 6 to 8 hours preferably?
Yes.
The thing is that once the mask gets soiled, you remove it, wear a fresh one.
Right. But while making it, at least 2 layers. It may be 3 light layers also. It should be made out of cotton and very fine muslin or silk, old silk. So something which becomes very soft, and we can make it 2 layers like that. And our people in Assam, they are making masks out of gamosas. That is also very good, I think. Very good, in fact, because everybody has gamosas at home. So I think that's at least 2 layers. And if possible, with lighter layers, maybe 3 layers also. And the masks that doctors use, like all, I wouldn't say just doctors, it may be nurses, it may be policemen, it may be any other workers, cleaners and all. So they should preferably wear the N95 mask. The N95 also, it is said that one N95 mask can be used for 1 day. The ideal is that you take 4 or 5 N95 masks, mark it day 1, day 2, day 3, day 4, day 5, or up to day 4 at least. Wear the first one without touching, remove it and keep it aside in a paper bag or a place where you will not touch it for the next 4 days. On day 2, you wear the mask which has been marked day 2. And similarly, you go on keeping. The 5th you keep aside. After 4 days, you can reuse the mask number 1. And this process can be repeated for a maximum of 5 times. So it's not that we wear the N95 mask today, tomorrow, and consecutively for 5 days. It takes 3 to 4 days time for an N95 to decontaminate itself.
Right.
So we have to keep it aside for 3-4 days.
Ultraviolet rays
That's how we
also
use
help.
it.
You keep it under the sunlight in your
sunlight is good enough.
Sunlight is not really recommended. Anywhere, you just keep it.
Yeah, that's a good thing that you brought up, because many people are concerned that we should be wearing N95 only, but it is actually not a layman who should be wearing N95.
No.
Just has to go to the market. It's unnecessary wastage of that resource. And secondly, the N95 with the respirator, if a patient is wearing,
it cannot be washed.
Yeah, and N95 with a respirator, if a patient is wearing it, actually it is dangerous, because the respirator is
very dangerous.
The virus is actually
shedding of the virus.
Yes, so that should be discouraged by people.
Absolutely.
Yes, I'd ask Madhumita to take I mean, tell us a little bit about this issue of that we are seeing about the stigma of this disease. It's almost something like what leprosy or tuberculosis used to be, or maybe HIV, what quite nearer home. Now people have a panic sort of situation if they hear somebody has tasted positive for it. I think that's not a very good thing to happen.
It's very sad that there has been a stigma attached to COVID as of today. But I wouldn't blame anyone. It's because of ignorance. People are not actually completely aware of the fact as to how infectious the disease is, how long a person infected could remain infectious, and various things which are evolving with time, even for us as a medical fraternity. But as a message to the society, I would like to tell people that please do not believe that this disease is going to be there with a person for life. A person who comes out usually comes out completely, and the mortality rate is less than 5%. And as you might have all heard about the convalescent serum being used for the treatment of patients. So if a person has had a high viral load, has had a very severe disease, if that person comes out, the serum of that person can be used in the treatment of other people, because that person becomes rich in antibodies. So that person is an asset to the society. So there's an appeal to everyone. Please do not think that this is a stigma like as other people, as Gautam has already mentioned, with HIV or tuberculosis. As we are getting out of it, we're learning to live with people who have HIV. We're learning to live with people who have tuberculosis. So we'll learn to live with people who have had COVID, because here they completely come out. And here there's just a word of caution that we have to be more careful, as already mentioned, with people above 65 or even 60 and children below 12, and any person with comorbidities, like someone has diabetes, someone has hypertension, any age, the susceptibility is higher. So there is no question of a stigma with COVID. And please, for God's sake, doctors are not going to be carriers, because we are very careful, and we hope that we will get ourselves tested from time to time whenever we think we've had a high risk exposure. So we cannot be bombshell to the society as many people are thinking as of now.
Okay, I would just like to add one point to Madhumita's sayings. Is it like that once a COVID is not always a COVID? Is that true?
Absolutely. Absolutely.
Yeah.
Because,
so, yeah.
Because as you know, the IgM antibody comes out within the first 7 days. Later would come the IgG. But now we do not know how long the IgG is going to last. But as long as the IgG lasts, the person is immune.
Right, right.
So IgM is a marker of active disease, and IgG is a marker of immunity. That's what we are targeting with vaccines.
Mm-hmm. Right.
Does anybody want to add anything here?
Yes, I would like to. In fact, Madhumita has said everything very nicely, and she's covered it. I would just like to tell everybody, like, reiterate what Madhumita has said, that, you know, the ones who have already recovered will be our saviors tomorrow. Number one. Number two, each one of us is likely to have it at some point of time, because COVID is here to stay. For how long? We don't know. It will be like pneumonia or any other illness. The problem right now is just that it is so infective that at the same time, one person can infect up to 3-4 people. That is the only problem with this illness as of now. Otherwise, having COVID is like having any other viral illness, which we handle each day, don't we? So I think it's very important to realize that at some point of time, it'll be me or my family members or my friends. Most of us are at one point of time going to suffer this. But at the beginning itself, we should refrain from stigmatizing these people and invading their privacy. That's another thing which is very important. They are being slashed across all platforms, and that's a very sad thing. I don't think we should do that at all.
Right.
So we need to make the people aware, the society at large, aware that once a COVID is not always a COVID. So it is fear of the disease, which kills rather than the disease itself. So
Absolutely.
Absolutely.
to educate, yeah, we need to educate people uh, regarding this aspect of the disease.
Yes, yes, Sanjeev, you want to say something? Sanjeev, go ahead.
What are the ways and means we as professionals can go ahead by increasing the awareness of the people? Now, many a times educated people are aware but more unaware. They put their foot into the wrong footstep and they create a chaos. I've got a neighbor who told me that I work in a laboratory. So the moment my laboratory opened, the landlord told me that this evening you don't come back to my home because from the moment you leave and join your work, I could not let you come back to your place, that is my rented house, because you may be a source of infection.
I think
Now,
Sanjeev
these
will,
are certain things which are running in the
that is a
society.
very,
We as professionals, how do we go ahead?
yes, this is a very important point. We have heard of stories happening in Orissa and many other places all over the country.
It has happened in
And yeah,
Gauhati also.
regarding this awareness thing, we'll come to in the end, we'll discuss this at length.
Right.
But
Right.
now I want you to tell us, I'll start with you rather, because you are a standalone practitioner. See, with all this stigma attached to this disease, initially it was maybe all right when we could, lockdown was going on, there were less patients, and we could sort of segregate the patients, we could screen the patients well, that if you're having fever, cough, you know that you should be little bit careful. But as of today, there are so many asymptomatic patients, and we want to see patients. At the same time, we don't want to run into unnecessary risks. So what are the difficulties that you are facing or will be facing in the days to come, in as far as your outlook, your sort of scenario is concerned?
So as far as me as a pediatrician is concerned, we have got two different categories of patients. One is who come for vaccinations and the second who come for illnesses. Now, in terms of vaccinations, what we have decided in our pediatric fraternity, we are paying more importance to the primary vaccines up to 1 year of age. The secondary vaccines which come later, they could come later on after the situation eases to a certain amount, say July, August or so. But right now we are paying our more emphasis on completing the primary vaccines up to 1 year of age. So for that, all of us, all my colleagues have drawn up different time slots, as I had said some time back, and we are trying to accommodate 3, 7, 5, 10, 15 in a day. Now that is one. And now in terms of illnesses, yes, earlier we did not pay much heed to the telephone call. Now what we are doing, we take a detailed history over the phone call itself and try to segregate, well, which could be staying at home. Do not rush to the clinic just now. Take 24, 48 hours in terms of time. Record your temperature. If this is the cutoff point, say 101 and above, give this medicine, observe for 4-6 hours, then get back to me over the phone. Do not make a rush, do not panic, do not come. On the other hand, there is another category of patients which you see, no, this is not a normal case. He needs immediate attention. So those definitely, they have a priority, they come in. And the other day I saw a very nice picture of Gautam examining his patients with a face shield, cap, gown. So we also have a setup like that. We also, me and my assistants, they do wear a protective gown. I don't know how far it is effective. Peace of mind mostly. So they come in, we see, and we maintain a very nice register of their name, address, phone numbers. And any suspicious case, we make it a point to immediately inform the health authorities through phone number 104. They make a note and we tell the parents, do not get panic because your number is there or your registration is there. It is not that you are a COVID, but we need to see that you are not a COVID. So that is how we are trying, but by and large, people are not very happy in the sense because they are not allowed to meet us as frequently as they have. The walk-in system has gone up now. You come entirely on appointments. So yes, we are through a passing phase. So earlier we had a 7-day week. Now we have cut it to 5-day week with less number of patients. Yes, there are possible.
Things are changing. Mandira,
Yes.
you come from an institute where a lot of people from the various industries, etc., come. They get free treatment, and you cannot deny them treatment. So, before the COVID problem started, I know that you had a unimaginable rush in your OPDs. So now, at this time, are you being able to control your patients, because that need to be controlled for their benefit as well as everybody else's?
Yes. Yes, Gautam. Actually, most of our patients are our beneficiaries. They pay a part of their salary from their salary for the medical benefit, for their medical benefit. So we cannot deny treatment to all of these patients. And so in the recent times, in the the coronavirus actually, what happens is some changes has definitely been roped in while examining the patients. We need to maintain a safe distance. As Sanjeev has already said, we cannot go and touch each and every patient like that. And being from the ENT fraternity, you might also be knowing that examining a patient, ENT patient, it generates a lot of aerosols.
Aerosol.
So we need to be very careful. And all these, and plus when we see us working with all the our protective measures, these acts are actually repulsive from the patient's point of view. So they don't like it, but still we try to make them understand that this is for your benefit only, that we have to follow or take up these measures.
Thank you. Yes, I'll come over to you. Madhumita, your turn. You have a reference.
I just had a comment to make that there is a lot of awareness amongst a section of people in the society about asymptomatic carriers. People, they just ask us, yeah, someone's got no symptoms and he's carrying COVID, so how big is the danger? There is one good thing about it is if you are an asymptomatic carrier, you shed almost nil virus is what the update still today that we've read. The viral shedding, that means the amount of virus that spreads from person to person as droplets is highest when the person starts coughing and sneezing. And, generating the droplets and putting them into the atmosphere or on the fomites. So for the asymptomatic carriers, as of today, for the general public, it is, don't be very worried. If you are maintaining all the norms that Sanjeev, Mandira and Monalisa has said about, it's for us to be worried as doctors. But for the general people, for the asymptomatic carriers, there is no need to have a huge amount of fear. Right. Because they are not spreading the disease as much.
Yeah, and one point I would like to add, Gautam, if you don't mind. This actually, as I have said, this is already, it's already repulsive from the patient's point of view. But having said that, there's also the question of, people have to wait outside the chamber for a long time, and which they don't like. And this, unnecessarily, generates an uncalled for situation. They land up in uncalled for arguments, heated arguments, and this is what we face in the hospitals, in our hospitals at least. So this is the cause of concern.
It's difficult when people start thinking that it's my right to have an access to the doctor.
Exactly.
And they do not understand.
And all of them would like to visit the. Yes, and all of them would like to visit the chamber at once, like 2 or 3 members of the same family, they want to come in, they want to know what is exactly happening to them. So it's a very difficult situation to manage,
Madhumita must be facing a similar sort of situation, if not that much, because as a professor, your juniors will be screening the patients at least.
Absolutely, yeah. And we have a very good triage area in the medical college as of now. So the patients who come with fever and respiratory symptoms, suspect COVID, are triaged from there itself. They're either taken a swab, or it's only those who have come across the triage would come to our juniors and then to us. So I should say that way, as of today, we are a little fortunate. We don't know what's going to happen tomorrow.
Monalisa, as a super specialist in a corporate hospital, I know you have a triage area definitely. How are you managing your work?
Yeah, our situation is that, a corporate hospital and its doctors, we have a symbiotic relationship. A corporate hospital has huge expenses. They have their own problems. So without revenue, which is literally stopped, practically stopped, without revenue, they cannot even have the bare minimum maintenance. That's very important. For people to get medical service from a corporate hospital tomorrow or day after, they must have the bare minimum. So what is happening? They are not they are not getting the support that is being offered in government hospitals. So they are having to spend extra for all their doctors. This is what I have seen. So they are having to provide, you know, PPE and everything to the doctors, to the other health workers. So here there has been some amount of compromise amongst the doctors also, or amongst the healthcare workers. They are having to offer the best PPE to the ones who are dealing directly. Stratified. And the ones who are less exposed will get slightly lesser things, you know, like maybe just N95 and gloves, which is okay for us in our practice. What is important is that almost all corporate hospitals have areas just like in the COVID hospitals. That's one good thing all of them have really tried to do. And the moment we get the symptoms like fever, cough, or anything, they are sent out into the COVID areas or in the triage areas, and then from there they are sent to GMCH or other places where they can get their tests done. The problem is with us in the casualty. Our casualty people are very, very overworked. And in neurology, in my practice, there again, I get two sets of people. Some who just come for checkups regularly because they are suffering from chronic illnesses like epilepsy, like Alzheimer's, Parkinson's. These are patients whom we can even do teleconsultations. But the emergency ones, especially the patients of stroke, which we manage, these are the ones who already have the comorbidities because of which COVID can be present in these people. So there have been instances all over the country where a patient of stroke with the comorbidities of diabetes, hypertension, cardiovascular disease, admitted in an ICU, is then found to have, you know, COVID positivity, creating a huge problem for the whole hospital. The hospital has to be shut down. So we are having to be extra careful in our casualty department, and our casualty department people, doctors are doing a great job. But here I think it's very important to again educate the people, make them aware, and they are taking certain steps to make them aware. All the time the video is going on, and then in this waiting area also there are, you know, seats which are covered. People are not allowed to sit, so there is social distance maintaining there. And we are trying constantly to make them aware that when you come to a corporate hospital also, the same things have to be followed for your benefit and for our benefit.
Yeah, almost all of us seem to agree that we need to cut down the number of patients that come to the hospitals or clinics.
Absolutely.
We need
Absolutely,
to have a system in
absolutely.
place, and we should try to do more with telemedicines, or either by way of WhatsApp
Absolutely.
phone or whatever could be the. I think in a way the government's move of digitalizing India is now paying off. People are becoming more aware, or more, they understand much more about digital media. But what is your satisfaction level? I mean, because most of us haven't been doing telemedicine as much. So, do you think you'll be able to sort of satisfy yourself, forget about the patient, by doing your teleconsultations?
Right. Here, you know, we are now going to a new normal. We are no longer in the past world. We are going to a new normal, and we have to attune ourselves to that new normal. And what I feel is that half of my OPD patients, especially the follow-up patients, can easily be consulted via telemedicine. And we have to start shifting. And then the best part is that there are third parties coming out with very simple and user-friendly apps, which takes away all the technical hassles from doctors actually, and also from the patients. They cater to all those things, and we can use those. And there are, you know, they have a facility there that if you feel that your patient, after hearing all that, all the history and talking to them and going through the reports, if you feel that this patient needs a physical follow-up, then you can always schedule an appointment for a physical checkup in your hospital. So those facilities are also there. And the government of India has come out with very distinct, clear-cut guidelines about telemedicine, which each of us needs to really read up. And if we follow those guidelines, I'm sure it's going to be a huge help to all of us in these
And
times.
I
I think
think
that's one thing which is very important.
and in
The guidelines are there.
in the medical colleges, for the medical colleges also, the government has started the e-Sanjeevani. E-Sanjeevani is a portal through which the patient can register, get a teleconsultation with the government doctors also. And
Yes.
what about Sanjeev? As a pediatrician, are you happy with, will you be able to deal with your children on telemedicine? You said
Well, there are always two sides of the same coin. For the last 25, 26 years, I've been having children in my lap, on my arms, on my legs. They all come together. They hug me. We work together. Definitely, I miss that. I miss that. But situation is such, you have to cope up. And in terms of satisfaction, if you ask me, well, without seeing the patient, I did try telemedicine. I do have an account, linked with PTM, etc. I've done everything done. 2-3 consultations have come in, but the satisfaction that I get seeing the patient in person is totally different. Probably I'll need some more time to get adjusted.
yes.
Yeah, absolutely. I agree with Sanjeev.
Does ESI have anything in place, anything in the future for?
Probably in the future.
You have a small staff and you've got a huge number of patients. You definitely need to have a control there. No?
Yeah, probably in the future they may be thinking about this telemedicine part, but as of now, right now, nothing of that sort has been taken up. So let's see in the time to come what happens and how things move. We'll have to wait and see.
Just one point I would like to add, Gautam.
Please.
Just one point. Yeah. With telemedicine, there are a lot of cons. We are so used to actually sitting across the table and putting the patient on the couch and examining. That's fine, but there are a lot of pros I have found as an epileptologist. My special interest is in epilepsy, and it's pathetic that 90% of epileptics in our country, in my state, have treatment gap. They cannot come for treatment. They cannot continue treatment for the simple reason that this treatment facility is not accessible to them. They live in the remotest parts. Now, even a doctor in the remotest parts can be a proxy to the patient and can do a teleconsult, and they will get the best of the treatment even sitting at their homes. They will save money in communication. They will save a lot of time. So I think we must attune ourselves to the pros as well as the cons and go ahead in life.
Agreed. Yes, you're very correct. Yes.
Madhumita, would you like to say something to sum up? We go to the next.
Okay, there's just one thing. I don't know if I gave you the right picture of the medical college. I told you that we have a triage area where patients are triaged and then they are sent to the MOPD or pulmonary medicine, wherever. But we are also working by turns. I have also been working in the screening area. I've worked in the triage area. We have worked, I've been in charge of the isolation. So we have worked in different zones. We have an exposure to everything. We go on rounds. So accordingly, we are given graded PPEs. We are given graded protection, graded masks, gloves, whatever, wherever, whatever is needed. So that we have. Unlike, as you in the corporate hospitals, as you can choose to be in one zone, we cannot. We are flushed into different zones, and we have an fair exposure of having handled everything, including direct COVID patients through video calling as well. So we have that exposure of the direct. And before, as you wind up, you should tell me what I should say.
Now,
if there's anything someone else wants to say.
As all of you have pointed out, there are pros and cons to telemedicine. But as Monalisa has aptly said, the times are changing. We have to adapt to those changes. Even though we would like to have the patient across the table or lie down on a couch and examine, etc. But wherever possible, and most of the time, if a patient is unable to come a long distance from where he wants to meet his doctor, he can very well have at least some amount of an opinion through the net or through the telemedicine facilities. As surgeons, me and Mandira, we are deferring our surgeries because of the government directives. We are not doing any high-risk surgeries, only which are truly emergencies. Again, regarding aerosol spreads and trying to avoid exposure to our co-workers, our anesthetists, our um, nurses, etc. And whatever we have to do, we have to take a lot of care. And people are understanding. People actually, when you explain to them why we are deferring their surgeries over 2 months and 2.5 months, they tend to understand. And what Sanjeev had actually brought up in the beginning is about the role of the educated person, the role of the social organizations in making the people in the lower levels. I wouldn't say the lower level is a wrong word to use, because even in the remotest of villages, we have been seeing on the TV, the people have barricaded themselves. They have acted so intelligently, I could say, by not allowing anybody. They have kept the community confined or protected. But what could the educated people and I mean, yeah, Mandira, you raise your finger. Okay, carry on.
I just wanted to add one thing before leaving, actually, that we have to make understand every individual in this COVID time that every individual has to be a warrior to fight against the COVID.
Right.
It is the duty of every individual. Only doctors or health workers or nurses or other social workers, that will not be suffice if each and every individual do not take up to his or her own that we need to fight COVID and we have to prevent ourselves for a better tomorrow.
Sanjeev, could you add? You wanted to speak in the very beginning. I stopped you there.
No, the thing is that it will have to be a joint effort, just as Mandira has said. Now, we have to keep many things in mind. Life, livelihood, COVID. It's a interplay that has mixed up us. So many times we know where we should react, where we should not react. So when I go by the road, I see a vendor sitting and selling vegetables. Well, I am in two minds, whether he's doing the right thing or not. When I go to the other side and see, well, he has to earn a living, he has to support his family. So if he stays at home, how does he live? How does he eat? And if he stays indoor for a long time, again, he has to earn by some other means which are not legal means. So we have placed ourselves, in fact, the whole world, the whole economy of the world has placed itself in such a way, it's a triangle, life, livelihood, and COVID. So definitely the Almighty will give us blessings and He'll path us in a way. And at the same time, if we follow the simple rules of hand washing, safe physical distancing, and wearing the mask, probably the end is not that far away. But as we, all the panelists have equally said, that this is a long war, it's not going to end soon. And the health ministry has also said 2 days back that we should a statement that we need to tune ourselves to live with the virus.
Monalisa, would you like to add something? Because Madhumita is going to wind up with some brief comments.
I would like to just, since this is going to go out to the public, I would just like to put forward a few points. We must understand that people in the, society who are renowned personalities, celebrities, or they are in the media, or even the media houses and non-government organizations which are working for the people, we must understand that they are people who have a following. So they are being followed by many. So each and every word that comes out from their mouth, they must be responsible for it. So they must be the sensible voice of the society. Number one, they must avoid all dramatization or sensationalization. They must stick to facts and figures without trying to sensationalize or make a drama out of things. Then each of us should instill a sense of responsibility into ourselves and just ask, what am I doing in this fight? And try to support the society or people near me as much as possible, and keep it very simple. KISS, keep it short and simple. Have I done my duty today? I would think of it like that, because if we have followers, if there are people listening to us, If I affect the thought process of even 2 people, good enough.
Madhumita, please.
So, having said all our important points, I hope we have carried a message to the society. I would like to give you a few take-home messages over and above what has been very nicely discussed by this elite panel of my batchmates. Masks, social distancing, hand washing, we have been saying about it. There are a few more tips which I think you can keep in mind. Number one, no handshakes. The namaste has come back into fashion. Number two, avoid cash transaction as much as possible. Let's go digital, because cash also, money could be a format. Avoid watches and jewelry. Sanitize your mobile phones with the alcohol-based sanitizers time to time during the course of the day. Leave your shoes outside when you get back from work or from anywhere outside home. Preferably take a bath once you're back home from work or wherever. Wash your clothes daily. I'm sure everyone's doing that. Extra protection for the pediatric and the geriatric, Sanjeev's group of patients, or normal children, and the elderly above 65 as they have defined, but anyone with comorbidities like hypertension, diabetes, cancers on treatment. Take a balanced diet. Vitamin C has been recommended in the form of either tablets of vitamin C or fruits. Adequate vitamin D supplementation. Please quit smoking for those who are smokers, because COVID attacks the lungs the most. Regular exercise, and above all, a positive attitude and a stress-free life, I am sure will come out of all these problems that we are hanging on to at the moment. Thank you.
Thank you, Madhumita.
Madhumita, you need to add 2 more points.
Yes.
Madhumita will be adding 2 more points.
Right.
One is sleep, and second is nutritious diet. Please add a few lines on that.
I
Sleep and
did
nutritious
say
diet.
a balanced diet. They have recommended more of proteins if possible. A balanced diet with more of protein. That doesn't always mean that you keep taking eggs and fish and meat. If you're a vegetarian, a vegetable protein rich diet would be good enough. Enough of milk, soya, curd, enough of fruits. Vitamin D supplementation has been recommended. And as I said, a stress-free life and adequate sleep. Because if you have regular exercise and if you can manage a stress-free life in the form of meditation, yoga, whatever, all that also helps in easing your anxiety and building up your capacity to face the situation.
And also one more thing I would like to add is, like people have been, like the wine shops are open, but this please don't take too much of alcohol that, in the hope of killing the virus, you kill yourself.
That's a very good message, Mandira.
So
Alcohol will not kill the virus inside you.
So thank you, friends. We end with this smiling note, and we hope we can smile at the end of this year. And for people who will be watching this meeting on the YouTube later, I'd like to inform you this is part of a series of lectures. We are having another recording which will be in Assamese, which will follow after this. And next week we are having a recording by Dr. Shabnam Das, one of our friends who stays in Calgary, USA, Canada nowadays. She'll be speaking about keeping our immunity well. So we'll have a series of lectures. Please do keep your tuning in to our YouTube account, that is Learning to Live in COVID times. Learning to live with COVID-19, sorry. Thank you very much.
Namaste.
Thank you.
Namaskar.
Namaste.